I've been a pelvic floor therapist for 24 years, and in this video, we're going to talk about 24 tips that my clients would have benefited knowing sooner versus later. Number 1, awareness that you have a pelvic floor and how important it is. I can't tell you how many clients have come into our office with a variety of symptoms ranging from orthopedic to pelvic issues, and they didn't realize how important these group of 14 muscles were to their symptoms and to their general health. So it's really important that both men and women understand that they have a pelvic floor and that they know what it is and what it does. Number 2, your pelvic floor is really important for your bladder. And speaking of importance, your pelvic floor is really important for your bladder health. Your pelvic floor goes through the urethra, and if there's any weakness or restrictions or tightness within these muscle groups, they can cause things like incontinence, urinary retention, feeling like you have to pee all the time, or even pain when you end up going to the bathroom. The next most important function is number 3. Your pelvic floor is important for your bowel health. Your pelvic floor, just like the urethra, goes through the rectum. And if there's any tightness or weakness that develops within these pelvic floor muscles, that can end up causing problems within the rectum. This can lead to things like constipation, hemorrhoids, and even fissures. And so the health of your pelvic floor is really, really important in order for you to have healthy bowel movements. Just like the bowel and bladder need this nectar of longevity, so does your pelvic floor. So number 4 is hydration. Water makes up 60% of the human body and muscles 79%. And so it's really important that your body stays hydrated. When you're dehydrated, waste builds up in your muscles, and that can lead to tightness, restrictions, and pain within those muscles. So staying hydrated, super important, not only to your bowel and bladder, but also to the muscles that control your bowel and bladder. Just like hydration is really important, so is its partner. So number 5 is fiber. Fiber, otherwise known as the roughage of plants, is really important for a healthy diet and for digestion. Without good amounts of fiber in your diet, your body can end up becoming constipated, which ends up leading to pelvic floor strain, which can then lead to things like hemorrhoids and fissures. And so it's really important that all healthy adults end up getting anywhere between 25 to 30 grams of fiber a day. And then when you end up drinking and staying hydrated and getting adequate amounts of fiber, then you end up with a healthy digestive system, healthy stool, and ease with having a bowel movement and less strain on your pelvic floor. Speaking of less strain on your pelvic floor, we're on to number 6. Avoid straining when you go to the bathroom. Breath holding and trying to push out a stool too quickly can lead to issues such as fissures, and it can also lead to strain of the pelvic floor. So even if you end up having a bowel movement that ends up being a little bit larger or even a little bit harder to get out, really the key is to just relax and to allow yourself to breathe and allow the stool to come out a little bit easier. But we can also use my next tip, number 7, use a squatty potty. Elevating your hips above 90 degrees by simply placing your feet on a stool or using a device such as a squatty potty improves the angulation of the rectum. The reason why this is important is because on standard American toilets where your hips are below 90 degrees, the angle is small. And so stool can easily get stuck or trapped and just not ease out as easily as when you're in a squatted position. When you're in a squatted position, the rectal angle increases, allowing stool to easily come out, preventing strain on your pelvic floor, which hence prevents fissures and hemorrhoids down the line. And speaking of sitting, number 8 is sit less. It's no secret that sitting for extended periods of time is not very good for your health and your overall body, and especially for your pelvic floor. When you sit on those pelvic floor muscles for hours on end, this can create a lot of compression, which ends up creating less circulation in these muscles, which can end up leading to pelvic pain. So if you can sit less, it's much healthier for your pelvic floor and your overall body and posture. Which brings me into number 9. Your posture affects your pelvic floor. Abnormal posture, whether it's with sitting, standing, or with movement, can end up causing different angulations within the pelvis. And an abnormal angulation within the pelvis can end up causing compensation within the pelvic floor muscles, either creating too much tightness or too much weakness in the front of the pelvic floor muscles or in the back of the pelvic floor muscles. So the angulation of the pelvis is really important for the health of your pelvic floor. So improve your posture and you'll improve your pelvic floor. And we can't talk about abnormal posture without talking about the repercussions on your joints. And so number 10 is pelvic floor contributes to orthopedic conditions. As I mentioned before, your pelvic floor is a group of 14 muscles that have attachments to things like the tailbone and the pubic bone. But what a lot of people don't realize is the pelvic floor also has attachments to things like the hip and the sit bones, and they can have indirect attachments to the low back as well as to the abdomen. And so if there's any problems within your pelvic floor, you can end up having issues that contribute to your low back, to hip pain, to your knee pain, and even into your abdomen, and many other more. And so the health of your pelvic floor is really important in these orthopedic conditions, as well as to movements throughout your day. And we can't talk about movement without talking about what many of us do, which is working out. So number 11 is listen to your body when you work out. When doing exercises, especially strenuous ones, such as running or heavy lifting, it's really important to listen what those movements are doing to your body. If you end up developing any sort of pain, especially pelvic pain, when you're doing heavy lifting exercises or heavy weighted exercises, then maybe perhaps change it up, reduce the weight, and listen and be aware of what your pelvic floor is doing. Because chances are, if you're getting pain down there, it's not normal. And if you're getting pain down there, then chances are your movement is off. And so number 12 is move with good form. And what I mean by moving with good form is that with almost every single exercise, there is a certain movement pattern, the correct way and the better alignment for your body, say when you're doing squats or when you're lifting something off of the ground, or even when you're doing lunges and overhead press at the gym. All of the muscles work together in your body. And if your movement is not correct, this will affect the muscles of the pelvic floor. And when you have to over-contract or under-contract and end up straining the pelvic floor, this could end up leading to a whole host of pelvic pain issues, which in turn can end up leading to other orthopedic issues. So it's really important that you move well. And if you're not sure if you're moving well or not when you're doing a particular exercise, this is where you can either talk to a really good trainer or even better, seek help from a physical therapist. And you can't move with good form without number 13, breathing correctly. Your diaphragm is one of the most important muscles when it comes to breathing, but your diaphragm is equally as important to the health of your pelvic floor. You see, when you breathe in, your pelvic floor relaxes, and when you breathe out, your pelvic floor contracts back to a resting state. And that coordination between breathing in and breathing out in your pelvic floor is really important for not only your general movement, but also really, really important for your general core strength. Having a balanced and coordinated core is important for everyone, and especially for pregnant moms, which brings me to number 14, pregnancy affects your pelvic floor. Most people think that a vaginal delivery is the only thing that affects your pelvic floor. However, just the mere fact of carrying a child for many, many months can affect your pelvic floor. So those who have had C-sections, you're not in the clear quite yet. So for every single mom, I highly recommend either before you decide to get pregnant, during pregnancy, and especially 100% after you've had your delivery, you need pelvic floor therapy and to have your pelvic floor checked out. It really is the key to progressing and getting your core back after birth. We've already talked about your pelvic floor being part of your core, which brings me to 15, perform pelvic floor exercises a few times a week. Performing isometric pelvic floor exercises, otherwise known as Kegel contractions, several times a week can be really helpful in not only strengthening your core, but also feeling that deeper connection with your abdominals and your low back. But in addition to that, it's really helpful for flattening that tummy, which builds confidence. It's important to perform isometric pelvic floor exercises, but it's equally as important to incorporate them with movement, which brings me to number 16. Perform pelvic floor Kegel contractions within your exercise routine. Connecting with your pelvic floor, whether it's through small daily things that you do every single day, or whether it's a workout routine such as Pilates, yoga, or working out at the gym, can be really, really helpful in really connecting that core into movement. Because if you're not connecting with your core throughout movement, this is what makes you susceptible to injuries such as low back, hip, and even pelvic floor strain and pain. Genital pain in women can include areas of the vulva, the vagina, and even the clitoris. And for men, they can include the scrotum, the testicular area, tip of the penis, as well as behind the prostate. 18. Pelvic pain can cause rectal pain and tailbone pain. Anytime you have tension that develops within the pelvic floor, you can become susceptible to developing pain along the entire perineal area. Sometimes this can be caused from excessive sitting or even a fall onto the tailbone or anywhere around the hips. So recognizing that some of these falls or even excessively sitting and creating compression around these muscles can end up causing you areas of pain that you didn't even realize could be coming from the pelvic floor, such as your tailbone as well as your perineum. Oftentimes, when people are starting to experience pain anywhere in the genitals, perineum, and even in the rectum, it's often associated with sexual dysfunction, which brings me to number 19. Pelvic floor problems can lead to sexual dysfunction. Sexual dysfunction in women can be anything from a pain or a block with intercourse, difficulty using a tampon, or significant pain with a gynecologic exam. And for men, this can include things like premature ejaculation, pain with having an erection, and even post-ejaculation. Which brings me to number 20. Not all doctors understand pelvic floor problems. Most doctors are concerned that there isn't something majorly medical going on that is contributing to the pain that you're having. And so many doctors will perform tests and have you take labs, and sometimes they'll come out negative. And if they don't really have any answers as to why you are feeling what you are feeling, then it might be that your pelvic floor muscles could be part of the problem that is contributing to your bladder or your orthopedic or your perineal and genital pain. And so this brings me to number 21. You have to be your own advocate. Medical doctors, as amazing as they can be, sometimes just want to be helpful, and they may recommend taking things like medications and rounds of antibiotics. And sometimes those medications can be helpful, but other times taking things like rounds of antibiotics can be detrimental to your GI system and can really cause more long-term problems. And so you have to be your own advocate. Listen to your body. Do what you think is right. And if you are having continued problems, then the chances are your pelvic floor and the surrounding muscles might be the culprit of why you're still in pain. And if you're still in pain and you're suspecting that your muscles might be the problem, then number 22, a holistic pelvic floor therapist can be an excellent resource. A holistic pelvic floor therapist that understands both orthopedics as well as pelvic floor can be one of your biggest allies to really getting you out of pain and into better function. A holistic pelvic floor therapist will also understand the mind and the body connection and how your pelvic floor affects it, which brings me to number 23. Your pelvic floor affects your mind and your gut. When you are in chronic pain, whether, for example, it's a pelvic floor related issue that's causing organ-related problems such as bladder, rectal, and GI dysfunction, or whether it's a pelvic floor problem creating orthopedic issue or vice versa. It's really important to understand that this creates stress in your central nervous system. And when your central nervous system is stressed, this in turn adds into the feedback loop of pain, creating further muscle tension and muscle pain. And not only that, when you're stressed, this actually will create a change in your microbiome balance. And when your microbiome is imbalanced, some of you may have heard that the happy hormone of serotonin, much of it is developed in your gut. And when your gut is imbalanced, it's not producing this happy hormone, which further feeds into the cycle of not feeling good. So it's really important to understand that there is a huge mind, body, gut, muscle connection. And if you understand this, then you'll probably understand how to exit out of it, which is really creating other techniques that help your mind and body to calm down your central nervous system, which will help muscle imbalance and tone. When it comes to your body's health, and especially when it comes to your pelvic floor, I've had lots of clients that end up coming in telling me that they think they've had pain in this area for years, but they just thought it would go away. Or perhaps they ended up having pain and it went away, but then it ended up coming back 2 to 3 times stronger than it did before. And so, why not identify it earlier, get relief quicker, and honestly, the longer you've had your pain, sometimes the harder and the longer it takes for it to go away. And so, why not enjoy more years pain-free sooner? These are just some of the tips and 24 years of knowledge that I think anyone can benefit from. And if you'd like to learn more, then check out our newsletter. And if you are having pelvic pain and looking for immediate relief and you don't want to do it alone, then check out our links in the description box below for our available solutions.